just want to start with a few statistics. 559,000. That's the number of seniors in Virginia who will lose free preventative care services on the first day of Romney presidency.
Because?
By repealing Obamacare, which made preventative care visits free, health and wellness visits free, and by opening up the donut hole, which would immediately affect 43,000 seniors who would see higher drug costs, we will talk about how, one of the most important statistics I think in this campaign, Mitt Romney and Paul Ryan have said many times, we have this plan for Medicare. Now we are going to, their first thing they want to be clear about is, we're going to protect current seniors. Well, for those of us that are not yet current seniors, that's a pretty big red flag that whatever's coming next is pretty bad if they have to protect current seniors from it. And we're going to talk about what it means for those of us who are younger. But it's also significant that it's not true. Their plan would cost current seniors $11,000 more in out-of-pocket expenses over the average course of retirement, assuming retirement age and average lifespan, $11,000 out of pocket. Now that may be a small wager to Mitt Romney, but to a lot of seniors, that's actually a significant amount of money. So we're going to talk some more about Medicare. One of the things you may have already heard that's gotten some play is the idea that 66,000 young adults in Virginia would lose access to their family plans, meaning they're going to have to go out and buy health care that currently is covered. 116,500 children in Virginia have pre-existing conditions that are already, as of last year, have to be covered under the healthcare system. But again, in repealing that, you would change that dynamic. We'll go through some of his ideas about where he's going to cut in the federal budget. And just to put one human number on that, 4,791 is the number of kids who would be kicked off of Head Start in Virginia. $1,372,000 women in Virginia will be turned back into dealing with the issue of being a woman being a pre-existing condition under the healthcare system. 1.3 million women in Virginia alone would lose access, guaranteed access, to pre- and postnatal care, preventative care, mammograms, pap smears, and other things that are covered under the bill that, again, he's been very proud to pull away on day one. There's one other number I want to put up, and then we're going to go through our super fun graphs. They're not really that fun, but they're important. 621. $621 is how much every Virginian or every Virginia family will pay in additional taxes just to cover the tax cut of Mitt Romney's largest donor. Now, the average tax increase for a Virginia family, as we'll talk about, is $2,000. But $621 just to go to his top donor, who, as we will talk about, gets a $2.3 billion tax cut under the first 4 years of a Romney presidency. That's $621 from every working and middle class family in the state in order just to cover that one tax break. Okay, so